All right, we've got another question, and it is, let's get into it. The question is regarding the appropriate action in the case of hyperprolactinemia and a prolactinoma in a patient with schizoaffective disorder due to prolonged uh, use of Invega Sustenna. Okay, so let's just pose it just like that. All right, ready? Let's see what happens. All right, so if I were to post that question like this, I would feel like it's coming from, like, say, a parent, maybe. And this is what's going on right now. It used to be that patients would go to Google, Dr. Google, and search whatever they wanted to search, but they would end up with tons of different things, and who knows, it would take them a long time to figure out what was legit or what was relevant. So here, as a parent, I would post that question to GPT-4 and say, hey, what can you tell me about this? So it's going to give us the message that it's not a healthcare professional, which is okay because all we're doing is exploring. Um, and again, I'm just operations here, administration, not a provider. So it's giving it looks like a pretty general overview. Consult a specialist, do a medication review. All right, so it's telling me as a consumer the different things that maybe I should be looking at, but it's not really giving me the answer I'm looking for yet. So let's go back to the question. Appropriate action in case of, all right, okay, let's see. A different way of phrasing the question could be, let's see, copy this, and copy, oh, using the wrong keyboard. So the question, I would rephrase this question, as a consumer, remember, can prolonged use of cause all right, let's see what happens. All right, so it's giving us some information. It looks like it's using some serious computing power there to tell us why a prolonged use of Invega and other antipsychotics could contribute to that elevation of the hyperprolactinemia. All right. Elevated prolactin levels can cause symptoms of, all right, women, long-term elevated levels can lead to more significant issues. Okay. Looks like frequent monitoring. Usually advised for patients on a psychotic medication, not only for symptoms, but also through laboratory tests to check prolactin levels. Especially if symptoms, okay. So as a consumer, I would be wondering if one of my loved ones was on this medication, a kiddo was on this medication, and somebody wasn't monitoring, I would have that question for my provider. Well, you put my kiddo on this Invega medication, and it's been a year, but we've never done any blood work. Am I missing something? That kind of thing. So the consumer becomes very, very aware very quickly. Now, I haven't vetted any of this information, so I don't know if this is a standard protocol. That would be my next question that I would want to ask from an operations perspective or administration, like for medical team leaders or medical directors, like, hey, does this make sense? But frontline providers as well. I mean, it seems like something you would want to know if you're prescribing Invega. Okay, so prolonged use of Invega can be associated with the elevated prolactin levels. Okay. All right, so I'm a consumer. Where do I go from here? I'm going to go just one level deeper. Say, can the negative side effects have, be dangerous? Again, consumer. Uh-oh. Something went wrong, issue. Okay, let's ask it to regenerate. Okay. Yeah, the negative side effects of hyperprolactinemia inducing psychotic medications like Invega can be quite concerning. Sexual dysfunction, bone density, menstrual irregularities, glaucoma, emotional toll, cardiovascular risk. Monitoring is critical. Okay. All right, so let me switch gears and act as a provider and say, as a prescriber of Invega, how would I communicate the risks to a fifth grader? Let's just do that. Okay. That's a challenge for sure. Explaining medical concepts to kids requires a different approach. Given your role and experience, you probably know the importance of using simple language and relatable analogies. So here's how I tackle it. All right, the basics. You might start by saying that the medicine helps balance out chemicals in the brain that make them feel unwell. Just like wearing glasses helps some people see better. This medication helps their brain work better. What is prolactin? To explain prolactin, you could liken it to a worker in the body that helps with things like making milk for babies and helping bones grow strong. But sometimes the medicine makes this worker too excited, and it starts doing its job too much. Cool. So, could a fifth grader understand that verbiage? Yeah. All right. That's again, if you haven't tinkered with GPT4, I would do it. It's changing the way we consume information, retrieve information, process information, and again, this all needs vetting. But at first hand, it looks pretty legit. Of course, you've got to go do your own homework, and if it doesn't make sense, it doesn't make sense. But then you could tell it doesn't make sense, and that's how they continue to train the AI. All right, ciao.